Right. Good afternoon or good morning to everybody who has joined us today. Welcome to this webinar. Once again, it is a pleasure to have you here today. This is the second webinar and the second part of this webinar that we are co-convening with UNICEF and Religions for Peace. The title and theme of this webinar is the role and impact of faith actors in overcoming barriers to COVID-19 vaccination. Once again, I'd like to just say that this is part of a series, and we are trying to invite different examples, different representatives from around the world. And so in itself, this webinar doesn't represent all faith traditions and all initiatives, but throughout the series, it is our aim to try and give voices to a large variety. So please do follow the series if you're interested, and also you can look back on the YouTube channel to see previous recordings of this series. So thank you again for joining us. We have a wonderful panel here today whom I'm not going to introduce. I'm going to leave that to our moderator, Reverend Sivan Pitt, who is the Program Executive for Public Theology and Interreligious Relations at the Lutheran World Federation. We're going to hand to you shortly, Sivan, but before I do, I'd like to hand over to my colleague B at UNICEF for her welcoming remarks.
Thank you, Sarah, and good morning, colleagues. It is such a pleasure to be online with all of you. We're so grateful for the continued participation because the feedback that we get has been absolutely invaluable. So my name is B. I head the Civil Society Partnerships team at UNICEF. We work very closely with faith-based organizations, and this partnership with RFP and WHO, along with the other organizations, some of them who are on the panel right now, has been immensely gratifying and fulfilling and so useful. I would just like to say that for all of us, working with faith-based organizations is absolutely critical as we continue this joint work forward, whether it's for our global advocacy priorities, whether it's for looking at how we work at community level to combat the impact of COVID. None of this can be done in silo. This has to be done together, and seeking the expertise from faith-based organizations has been a very central pillar to all of our organizations' work as we move forward. So just echoing what Sarah is saying, we hope that you continue to be part of this journey with us together for the series, for this webinar series. And we're very much looking forward to not just the amazing panelists today, but also the participants and feedback that comes from you. So thank you very much for joining us. I know it's really late for some of you, but it's great to have you on board. So thank you very much. And I'm going to hand over to Deepika.
Thank you, B. Good morning, good afternoon, and good evening, wherever you are. On behalf of Religions of Peace, I join Sarah and B from WHO and UNICEF, respectively, in welcoming you all. My name is Deepika Singh, and I serve as the Associate Secretary General and the Director of Programs at Religions of Peace, global multi-religious movements present in 90 countries and 6 regions. As B mentioned, religious leaders, institutions, and faith-based organizations have been critical players in responding to COVID and addressing the needs of the people, particularly the most vulnerable among us. Now, when the world is witnessing vaccine shortages and hesitancy, there is a really urgent need for all of us to work together to ensure equitable vaccine distribution and uptake. In fact, it is a moral imperative to secure fair and easy access to vaccine for all. We know that religious leaders and faith institutions have been leveraging their influences, credibility, reach, and networks to overcome such barriers. And we're so delighted that we will hear some of the wonderful work that is taking place with its successes and challenges. But before we start, let us observe a moment of silence for all the lives that have been lost and for all those who have been and are still continuing to be affected by COVID-19. So a moment of silence, please. Thank you. I hand it to Sylvain now.
Sure, maybe very quickly before you come in, Sylvain, I'll just remind folks that we will have a discussion at the end. So if you do have any questions for any of the speakers here today, please feel free to put them into the Q&A, and we will be sure that we can address some of them in the time that we have. So Sylvain, over to you now.
Thank you very much, Sarah and Deepika and Bee, for the opportunity here to moderate a very distinguished and wonderful panel of speakers with different roles and backgrounds, faith traditions as well, both Catholic, Protestant, Buddhist, and especially Indigenous perspective. And we are really looking forward to their contribution for not only their deep personal insights, local and national context, but also even a global perspective as well. So I'll introduce the first speaker first, which is Reverend Canon Rachel Carnegie. She's the Executive Director of the Anglican Alliance, and which supports the churches and agencies of the worldwide Anglican Communion in the areas of development, relief, and advocacy. So over to you, Reverend Rachel.
Thank you so much. And Sarah, if I might have the slides shared, please. Terrific. Thank you for the invitation to join today. And during the pandemic, it has been really encouraging to see the deepening partnerships of faith communities with WHO, UNICEF and other international agencies, but also between faith groups, including through Religions for Peace. Next slide, please. I was stimulated and inspired by the discussion in the webinar last week, and I'm privileged today to add our perspectives from the Anglican Communion, supporting churches and agencies across the worldwide Anglican Communion churches with a COVID-19 response. And today we're discussing the role and impact of faith actors in overcoming barriers to COVID vaccination. The image of water in my slides is a reminder of what's often been said about the pandemic, that we're all in the same storm, but we're not in the same boat. Inequalities of global vaccine access are a scandal. At the end of May, it was reported that a person in a rich country has a 1 in 4 chance of being vaccinated, while a person in a poor country has the chance of 1 in 500. The Anglican Archbishop of South Africa, Thabo Makgoba, has said, the poor are suffering from vaccine apartheid. Next slide, please. Earlier this week, I had 2 conversations with colleagues in sub-Saharan Africa, which exactly illustrate the barriers to COVID vaccinations. A bishop told me how his region had recently received 250,000 doses, but fake news had been circulating, so people were hesitant to come forward. But also the governance and the infrastructure were weak and unable to mobilize. And so 75% of these vaccines were thrown away. The next day, I spoke to a colleague in a country facing a devastating second wave of infections. Intensive work, including by faith leaders, has overcome people's concerns. So there are lengthy queues at the vaccine centres, but a lack of vaccines. Reportedly, just 20,000 doses left in the country at this time. So today I want to reflect briefly on our experience as the Anglican Alliance in seeking to overcome these 3 barriers: vaccine hesitancy, inequitable vaccine access, and structural issues. The challenges are indeed great, and we continue to share and learn from others. And we need each other to help make everyone safe across the world. Next slide, please. Overcoming vaccine hesitancy. It was good to hear others talking on this issue in the last webinar. I won't therefore go into details, but just to say that listening to local contexts, research, and shared learning has been crucial. Our Global COVID Task Force has developed an online resource hub shown here, which includes information to answer genuine questions on vaccines and also challenge fake news. Like others, many of our clergy are vaccine champions using social media, and we have numerous churches serving as vaccine centres. I just want to highlight our latest initiative, which is to convene national conversations with church leaders where they can raise any questions or doubts about vaccines to help them as champions. It's crucial that these conversations are hosted by a trusted person who then facilitates the discussion between church leaders and a medical expert. And by focusing on the specific national context, these conversations are proving impactful. Next slide, please. Turning to global vaccine equity, we're in constant touch with churches to map the situation at country level. We also took time to research and consult widely on a global policy position paper to guide and give substance to our advocacy asks. Through this, for example, we established that we should advocate not just for patent waivers, but also highlight the need for sharing technological know-how, vaccine recipes, materials, etc., to equip a massive upscale in production around the world. As faith actors, we also stress the moral imperative alongside the health and economic drivers. That vaccines are a global public good, not least in that many were developed with public funds. Speaking as global faith communities, we stand together committed to equity and urgency. Our Anglican leaders first issued a joint statement in November last year. Many also signed up to the People's Vaccine Alliance statement. And recently, the Archbishop of Canterbury issued a statement along with other global faith leaders and the leadership of ICRC, WHO, UNICEF, UNHCR, and others. Prior to the G7 summit, the Anglican churches also coordinated an advocacy initiative through their governments. And we're now working to analyse the G7 outcomes and maintain momentum. And finally, many Anglican churches have worked with other faiths to support national fundraising efforts for vaccines on the basis of get one, give one. For example, in England, the Archbishop of Canterbury convened a meeting with the chief rabbi and a senior Muslim leader, along with UNICEF UK, the government, and the National Health Service, which led to the launch of the Give a World a Shot fundraising campaign. Next slide, please. And thirdly, we need to consider how faith actors can assist in overcoming structural and systems barriers. Holding governments to account is crucial for vaccinations, but also for strengthening health systems in general. Faith leaders should ideally be represented at government planning tables, as we did with the HIV response. We can also further mobilise faith health systems and advocate that vaccines are distributed also via non-government channels. And finally, faith communities have a vital role in identifying those who are excluded and hard to reach, such as undocumented migrants and the homeless. And they're inspiring examples of faith centres providing vaccination on a welcoming and no questions asked basis, and also of outreach into vulnerable communities. Last slide, please. There is a long way to go. And whenever I talk with churches around the world, they always highlight the value of solidarity, of connection and prayer, of traveling together through this pandemic. Sustaining hope is vital. The Anglican Alliance has an ongoing initiative of facilitated conversations around building hope together as we reimagine our world. We value sharing the journey with you all. Thank you.
Thank you very much, Rachel, for this excellent presentation and just reminding us again the different dimensions that are important, not only the contribution of faith leaders to address issues of vaccine hesitancy and vaccine equity, but also linking the national and global responses. And especially appreciate you highlighting the interfaith aspect of it. That we're all in this together. And I think the closing phrase, building hope together, really aptly just summarizes what you have tried to say to us. So thank you so much. And I'd like to pass the time next all the way to Japan to Reverend Megumi. And she's the director of the International Interreligious Cooperation, Risho Koseikai in Japan. And she's the co-chair of the Religions for Peace International Women's Coordinating Committee. And I think it's really interesting for us to hear a Buddhist perspective. And also, I think it's a late night over there for you in Japan. So over to you, Reverend Megumi.
Thank you. Thank you very much, our moderator, Reverend Dr. Kit, and everybody. I'd like to thank for inviting me this important meeting and for giving me this opportunity. I'm very glad to see you all. My name is Megumi Wada from Risho Koseikai, which is a Buddhist movement originated from Tokyo, Japan. Our founder, Nikkyo Niwano, was one of the founding members of Religions for Peace, and the President-designate, Reverend Kosho Niwano, is serving as a co-moderator of Regions for Peace. At Risho Kosekai, the first priority was to prevent the spread of infection and protect lives, and we stopped our collective activities. Although it is not enough, we are supporting the local communities and essential workers. At our hospital, called Kosei Hospital, we found out that an elderly person who had been hospitalized for a fracture in February last year, 2020, was infected by coronavirus. And since then, we have accepted many infected patients every day as one of 4 designated hospitals in Suginami Ward of Tokyo. In Japan, the mass inoculation for the elderly against the coronavirus started nationwide in May, and now about 30% of elderly people completed the first inoculation. Suginami Ward of Tokyo began the operation on May 17th. Risho Kosekai, at the request of the local government, offers its headquarters facilities as a vaccination site, along with ward facilities. We accommodate about 400 people for vaccination every day since May 17th, and it will continue until November. We advocate in collaboration with doctors at our hospital and local government, providing information based on scientific findings to the grassroots through our members and local people, so that as many people as possible can receive vaccination safely and with peace of mind. COVID pandemic also created isolation, and those who previously felt they had no need for religion are now seeking a source of solace. In this situation, our members are connecting families and communities with people isolated by providing support, such as buying groceries when they are quarantined after infection, delivering messages to family members in hospital, and caring for those who cannot receive support after being released from prison. On the other hand, there are reports that the guidelines issued by the government restrict funerals, create discrimination against infected people. Corona's challenge is that neither the dying people nor the survivors are able to say goodbye to their loved ones. The Japan Federation of Buddhists urges, based on the national policy, we would make efforts for hygiene measures to prevent infection in accordance with the arrangements of medical instructions and funeral halls. On the top of that, we must respect the wishes of the bereaved family as much as possible and take care to respond in a sympathetic manner. It is social responsibility for religious communities to pay the utmost attention to the prevention of infection and to promote understandings among believers will lead to the prevention of many lives. So far, no cluster has happened in the major religious sites. And we, Risho Kosekai, in collaboration with a Catholic group called Saint Egidio Community, has just issued a joint appeal to provide vaccine for all people in Africa. And now, as you know, the government of Japan is going to host the Olympics and Paralympics Games in July and August as planned. However, the subcommittee experts raised the risk for the medical burden and advised not to host. The opinion poll conducted in late May, over 60% of the people said they should oppose or postpone the Olympics again. The government does not seem to listen to the voices of the experts nor people and insists The mission of the Tokyo Olympics is to show the legacy to overcome the common challenges around the world and to contribute to the regeneration of the bonds in a divided world. But they do not show how based on the scientific facts and findings. The government seems to try to implement the games as an already decided matter without sufficient discussion. In a sense, people feel partly giving up because the decision has already been made. It might be similar to the situation where we entered into the Second World War without criticizing the government decision. Thank you very much for your attention. Thank you.
Thank you, Reverend Wada, for your contribution. And I think you really highlighted something that is very human and very personal, especially when you talked about that feelings of isolation and not forgetting the kind of pain that many families have been going through because of funeral arrangements. And all of this, I think faith communities and people like yourself have been really stepping in. So that's the comfort side of things. But at the same time, you also have to deal with being critical with the government when it comes to policies or restrictions or whatever plans they want to make. And I think the Olympic case is a challenging one, and we do sympathize and stand with you during this difficult time as well. But we appreciate your work, and we will be looking forward to hear more from you afterwards in the discussion. The next person I'd like to invite is Monsignor Robert Vitillo from the Permanent Mission of the Holy See to the UN in Geneva. And more importantly, for our purposes here today, he's the Secretary General for the International Catholic Migration Commission. And I'm sure he would have much to tell us about the work that you do, both on the ground as well as globally. So over to you, Monsignor.
Okay, thank you very much. And thanks to the organizers for inviting my participation. I'd like to look at both the wider Catholic Church involvement in the response to COVID-19, as well as the work of my own organization, which was suggested that I focus on as well by some of the organizers of the meeting. First of all, for the Catholic Church, which very much has been influenced, as in many areas, by Pope Francis, he took a very visible and a very active response to COVID and really led our work and continues to do so. The photo that you see here, I consider iconic. It was taken at the time when Pope Francis organized an extraordinary session of prayer on March 28th, 2020. And he came alone in St. Peter's Square, which for those of you who may not know, it is a massive area which usually is filled with thousands of pilgrims at major events like the one that he called that night, although this was a very unique situation. And he too used a boat image, Canon Carnegie, but with a little different twist, which is probably not surprising. And there he said, we are all in the same boat. And he focused on the suffering of everyone in the world in all sectors of society. But he said, we will not be able to survive unless we all learn to row together. So I think these were two different images, both perhaps valid, but very interesting, same, and so much of the imagery that Jesus brought us in the gospel certainly also looked at the boats. He then concentrated a great deal on people suffering, but also on the need for us to prepare the future and to have a broader view when preparing the future, and not to go back to what we thought was normal, but certainly was not normal in any way, the way we were living and behaving with each other. He used that same theme and the same approach in his addresses to the church and others who were interested shortly afterwards in Easter of 2020, and then again at Christmas, and also in his addresses to the diplomatic corps accredited to the Holy See. We have formal diplomatic relations between the Holy See as a country with about 178 countries of the world. During the summer of last year, he used the theme of COVID and the responses to COVID and preparing the future in his weekly general audience addresses. At that time, he was giving them virtually because of the social distancing rules. And during that time, he focused a great deal on appealing for universal access to affordable treatment and vaccines, even though we did not yet have an available vaccine at that time. He stressed the same issues in bilateral discussions he had with a number of heads of state who asked to speak with him during this time, with the UN Secretary General and with several heads of multilateral agencies who came to speak with him either remotely or in person when it was possible to receive visitors at the Vatican once again. The Holy See delegations to WHO, WIPO, and WTO, World Intellectual Property Organization and World Trade Organization in Geneva actually struck those same themes and very actively advocated for universal access and also for sharing of intellectual property and technology, and calling for a permission to give voluntary rights to countries because of this exceptional situation. So allowing them to produce the vaccines when they had the technology to do so. And then also the same theme was struck by the Holy See delegation in the UN General Assembly in New York and with the World Economic Forum as well. The Pope also gave some TED Talks striking those themes as well. Next slide, please, Sarah. Next, thank you. So he also very quickly organized a COVID-19 Vatican Commission. And he wanted us to make sure that we rooted ourselves in what we do as a church, and especially with those people who are on the peripheries, as he frequently refers to them, so that all people could be included in the response, but then also focus a great deal of advocacy at the global and the local levels. So you could see, I won't go into all of this, and the slides are available. I'm sure that Sarah can make them available to the participants. But basically, we wanted to listen to local leadership of the church. And so there were many, many different ways of listening to the bishops, the clergy, the people at national level, and then also to hear what their needs were. And so we had a funding mechanism that was set up. To begin to co-create, as he said, integral creative solutions. And there we had several technical working groups. I participated in the working group on the economy, and we were producing briefing papers each week. Some of those points that we made were taken by the Pope in his own addresses, and then others were integrated in our advocacy at different levels. Certainly communications was an important part of that work, and then supporting diplomacy and global relations through the kinds of diplomatic inputs that we had at the General Assembly, the G20, the G7, TED talks, and then the World Economic Forum, and then building a pipeline of resources. And we built it on 4 pillars. One was dignity in work and the jobs of the future, from one to many, new structures for the common good, governance, peace, and security at the heart of global solidarity, and rebalancing social systems with nature in the wake of COVID-19. So trying really to look at the future while we also responded to the present. Next slide, please, Sarah. And actually, you could go one beyond that, that has some of the background information, but I'd rather go to the next one. Thank you. So then there's a special commission on health at the time of COVID-19 that was set up by the COVID Commission, developed a 20 points document on COVID-19 vaccines. And this was really to address the vaccine reticence, but also to get good, factual, evidence-based information. And we borrowed extensively from some of the great work that Sarah is doing with her colleagues in WHO. And these were some of the issues that we focused on because we knew they were especially sensitive issues, but there were many more that we dealt with there. One was that we knew, because of the Catholic Church's teaching, that life begins at conception and ends with natural death, that there were concerns that some of the vaccines had been developed with cell lines that came from aborted babies. And so we wanted to help people understand that while we don't agree that abortion is a regular means of family planning or even healthcare, we do know that some of this happens. And if they have a choice, we encourage them to choose a vaccine that did not have this situation. But in many cases, people don't have a choice. And our best ethicists made the point that just simply to take a vaccine made in this way did not in any way signify cooperation with abortion, and that people could take these vaccines with good conscience. On the patents, that we really saw the vaccine as a good to which everyone should have access without discrimination, according to the principle of universal destination of goods. On moral responsibility of undergoing vaccines, the issue involves a relationship between personal health and public health, showing close interdependence. In the light of this connection, we consider it important that a responsible decision be taken in this regard, since refusal of the vaccine may also constitute a risk to others. And in this way, Pope Francis very quickly, when Vatican City got access to vaccines, very quickly signed himself up on the list to be vaccinated. And he also decided at that same time that we would offer vaccinations to many of the homeless people who come to Vatican City for other kinds of care, for food, for shelter, for other kinds of care. And we've had 2 massive vaccination programs in that regard. And he's encouraged local church leaders to do the same. And then the church at the service of healing the world, leading by example in ways that are clear and contribute significantly to achieving the goal of equitable distribution of vaccines and treatments. Next slide, please. This is a little bit about my own organization, the International Catholic Migration Commission. Again, I won't take a lot of time, but I can share with you that this is a network of Catholic bishops' conferences in all of the world that we were established 70 years ago by Pope Pius XII to help the church respond to refugee and migration emergencies, and also the regular programming and responses of churches throughout the world of the Catholic Church. We also work very closely with other churches and with other non-governmental organizations. Certainly, we very quickly recognized that 80% of the world's refugee population and nearly all of the world's internally displaced people are hosted in low to middle income countries, many of which have weaker health and water, sanitation, and hygiene systems, and dealing with multiple emergencies, including war, abject poverty, and environmental degradation. And so we saw them as being at heightened risk of coronavirus infection, both those in camps, but also those in crowded urban slums. Next slide, please. For ourselves, we saw the safety of our beneficiaries and staff as primary, and also of their families and their local communities. And so we tried our best, first of all, to supply personal protective equipment to the people who were working with us and to our beneficiaries. And when it was possible for people to come into our offices, we certainly tried to take all of the measures that were necessary. Although consistently in one country after another that we've been working in, there were lockdowns. And so then we had to really switch the way we were working to a virtual means. And we surprised ourselves that we were able to do so much service virtually, and yet we found the challenges. I'll give you one example. In Jordan, we have a contract with the OCHA, the Organization for Coordinating Emergency Aid, and there we were supplying cash assistance. We could not bring it out. The government said, no, we were not an essential service, so we could not leave our offices, and yet these were not people with bank accounts that we could make an electronic transfer to. And we tried to get the government to recognize us as essential workers, but they would not. So those were some of the challenges we had. We also, in Pakistan, we have a series of medical clinics along the border of Pakistan and Afghanistan. And we kept those open at the request of the government. And recently we reopened again at the request of the government an intensive care unit for COVID patients in a hospital in the Khyber Pass area. Next slide, please. These were some of the other things we tried to do. Certainly we have massive WASH programs already, health and hygiene education programs. And so we certainly quickly included the COVID messaging there. We needed to assess domestic violence. We have 3 major programs in Jordan, Pakistan, and Malaysia for the survivors of sexual and gender-based violence. Many of them were in lockdown with some of the perpetrators. And so we again worked very hard to try to, we actually did peace building education within the apartment. So it was virtual, but trying to help them build peace among themselves in these crowded apartments in Kuala Lumpur and other places in Malaysia. We continued our work on processing applications for resettlement to third countries, but a lot of the travel was blocked. And then we continued our counseling support, and we did fundraising to raise more money to support both our own direct operations and our member organizations throughout the world. On the advocacy level, ICMC coordinates and convenes a group of about 2,000 NGOs that are involved on the implementation of the Global Committee for Migration. And so we joined them in written and spoken advocacy at the UN and in other multilateral areas, again, advocating for policies and laws that offer healthcare, vaccine access, and economic support to all, including migrants, refugees, and internally displaced persons, without regard for their status. We also appealed for the release of people from the dangerous conditions in detention and from risky camp conditions. And then we promoted entry and safe working conditions for international migrant seasonal workers, and then allowing humanitarian workers to deliver needed cash and daily living supplies to vulnerable migrants and refugees. I'll stop there and thank you again for the privilege to speak with you today.
Thank you, Monsignor Robert. There's a lot there, I think, for us to just take in, and I think the slides will be made available for others. But I want to just highlight especially thank you for mentioning the refugees and also not forgetting those who actually have been experiencing domestic violence at home. And that is such an important point that I think we easily forget, that being locked down and being trapped at home is such a dangerous situation to be for many people. And it's important for us to remember that. And of course, this week is World Refugee Day. So I think bringing up that important part was important. We'll talk more about that later. But without further ado, I'd like to pass the time to Priestess Beatrice Schulthess. And as she presents, some of you may still want to put some questions to us. Please feel free to do so either in the chat or in the Q&A. But I pass the time to Priestess Beatrice first. Over to you as we hear the indigenous perspective, which is very important for us. Thank you. Over to you.
Okay, thank you very much, Mr. Moderator, and also thank you to all those who are working so hard in WHO and in Religions for Peace, in other organizations to get this going. I will start talking about the challenge that many of you already mentioned, but that is global and affects in particular indigenous people and other sectors of society. The challenge that we are facing is the growing reemergence of economic nationalism in certain countries, as well as the drive for economic growth of certain pharma companies. These practices have now become more important than the human rights to health that all people are supposed to have. These practices are unethical and go against common values that each one of our religions and faith traditions that we represent stand for. Some Western countries have purchased and secured more vaccines than what they need. One of the G7 countries secured 3 times more than what is needed for their entire population. And now we hear that during the G7 meeting, they decided to donate millions of vaccines to poor countries and people. But these donations will not go to the WHO COVAX initiative for equal distribution. No, they will go to the countries that they choose, which means that they will continue to apply practices as usual and that are in line with their interests. They will come to our countries and say, we help you with this, but we expect you to in return to do this and give us that or whatever. One of those countries that will provide such targeted help is in particular interested in mining projects in our regions and which are located in indigenous territories. A very highly unethical way of doing things, very, very unethical. Religions and faith traditions should, and I hope that we can do it, we should take stronger actions together. It seems to me that sometimes some religions do a lot, express themselves, warn people, just like some of our leaders warned others in the past also. And we should work together, for example, to reach out to heads of states, politicians, business leaders, investors. Anyway, to find the right person to raise consciousness and find ways to stop those practices before much more harm is being done. To obtain vaccine, nation states are considered the clients, market, business, and they must sign contracts with the pharma companies. These contracts contain provision of strict confidentiality and of limitation of responsibilities. Also, some of our countries are being discouraged in different ways from purchasing other vaccine options. Costa Rica purchased the Pfizer BioNTech, and until recently, this was the only vaccine option available. Since this vaccine requires special storage conditions, the vaccination only takes place in health facilities throughout the country. It was therefore impossible to vaccinate indigenous people in faraway territories. For example, in my province where I live, which is Limon on the Caribbean coast. To reach certain indigenous territories, it is necessary to take boats, walk long hours, or perhaps even days. Finally, what we have is a lot of loss of lives in indigenous territories, not only here, but throughout Meso and South America. More recently, Costa Rica now purchased AstraZeneca, and this is the vaccine that is being used to vaccinate the younger generations. As indigenous people and spiritual guides, we had to find ways to help with prevention and with healing where and if possible. A network of spiritual guides and specialists of various disciplines of traditional medicine from our region was set up, and we started sharing knowledge. It is a very nice and encouraging initiative. Not always easy, because one plant can have different names depending the location and language used. So for example, I spent quite some time sending pictures to Mexico here and there, and then they say, yes, we call this so and so. So we were able to help, in particular in Honduras and in Nicaragua, with certain communities which had serious problems. 170 WHO member states acknowledged the use of traditional and complementary medicine in 2018. Since throughout our region, the inequalities existed already before the pandemic, we indigenous people need to strengthen the knowledge and practices of traditional medicine. Personally, I was fortunate to have access to the vaccine, but I continue to take my traditional medicine daily as well. Following a call of the health officials, I joined a group of leaders that are helping to identify people that are not registered in the health system, and we try to pursue them to vaccinate. In our country, vaccination is free of charge for everyone, including foreigners that are at present in our country. There are still people that do not want to vaccinate. And I am not sure that it is always because of fake news. Some people are very thoughtful and analyze documents written by scientists, etc. So to counter the skepticism and such opinions and beliefs, our government launched a campaign called Frena la Ola in Spanish, which means hold up or stop the wave, making an analogy with the surfing waves. Many sectors of society joined the campaign, including some churches. I say some because in Costa Rica, due to the restrictions, the houses of worship are currently closed, and some religious leaders are very unhappy. Only the official health centers are authorized to administer vaccines. In my province, some religious leaders promote the vaccinations via radio stations, internet, and social media. As indigenous people, we go out and visit people in the community. We do our ceremonies outside in community with all the elements of nature, honoring Mother Earth, that provides all we need, including medicines that are being used the traditional way, but also by medicine in general. I will leave it there for the moment. Thank you.
Thank you, Priestess Beatrice. And I apologize for not giving you a fuller introduction just now. I was so excited to hear you speak that I just went ahead and just passed the time to you. And Priestess Beatrice is the president of the Indigenous Peoples Ancestral Spiritual Council, honorary president of Religions for Peace, Indigenous, Costa Rica. And I really appreciate that you actually lifted up, especially the issues of economy and inequality, which this pandemic has revealed, not so much of generated in the sense it has, but even revealed what was already underlying there, and the importance of transparency and accountability in your opening remarks just now. But also not forgetting that there's ongoing work that you are doing that is trying to deal with fake news and bringing in the insights of science, and also uplifting the spirituality of indigenous peoples. So thank you very much. Now, I'll continue to invite our participants to share questions or any comments, either in the chat or in the Q&A. Now, some of you have already shared how you have been inspired by our speakers, and that it has inspired you to want to do something for your community. So please feel free to do that. And we're going to have a time of discussion right now, and the speakers may maybe draw from each other even as we continue. And there are some questions already coming up. Maybe I should start with the first one, because someone from Taiwan actually thanked Japan for the donation of vaccines over to Taiwan. But this person from Taiwan actually asked a question, the more human question here, about how can we comfort the sorrowful families and convince the whole society that vaccines are still beneficial to most of us? Some people are trying to struggle with this, the whole question of comforting the sorrowful and convincing the whole society of the vaccines. Maybe I'll go to Reverend Wada. You could elaborate a bit more, and others as well. Over to you, Reverend Wada. Maybe you can start first.
Yes, thank you very much for the comments and also the question. And it is very, very difficult. And also as a people of faith, maybe we can start with empathetic attitude to the families. And firstly, we can just listen to their sorrows or stories. And but we cannot hide, or we cannot force the people to take vaccines. So maybe we just try to provide the right information based on the facts or information from the doctors. But I think that first we have to listen very, very carefully to them. That is the first step. Yeah, thank you very much.
And I wonder, other panelists, maybe you want to chip in, this balance between scientific information and the religious complexity, ethical complexities that Monsignor, you mentioned earlier for the Catholics. And so you have this pastoral dimension, you have the scientific facts dimension, you have the ethical parts. Perhaps Rachel or Robert, both of you would like, either one of you, or Priestess, Beatrice or Robert, go ahead. I saw your hand.
Yes, thank you for raising the points. I think it's really very important because at times we became so lost in the scientific and the medical aspects that that even those of us, involved in ministry to people, pastoral ministry to people, put that aside in some ways. And I know very early on, I was approached by a number of theological experts to see what we could do about making sure that our regular liturgical and sacramental ministry would be able to continue, even in a time when there were such restrictions in the hospitals. And so again, I depended a lot on Sarah and her group's information, and we worked together to develop the ways that we could continue the anointing of the sick and other sacraments, in a way that was safe for the patients and not leave them totally isolated and alone. Later lockdowns sometimes prevented us from doing that, and certainly prevented the family members. So it is important to remember that comforting the sorrowful is a very, very important aspect of our work as religious institutions, but also for those who may not have a particular faith commitment, but who also are people who have emotional and needs as well. I think that the other thing that we faced, even here in Switzerland, in Geneva, was that when the opening up started, they did not include the churches in the opening up. And yet there were many other activities, social activities, recreational activities that allowed people to come together once again. And so a number of people, including a doctor that I know, became involved in bringing a suit against the government to say this is discrimination against people with faith. And they won the suit, so we were able to reopen the churches then.
Rachel, go ahead. Over in the UK.
Yeah, thank you. I really, really agree with both what Reverend Wada and Monsignor Vitello has said. I think remembering ourselves that what is it uniquely we bring, and of course it is about the compassionate accompaniment, about the faith consolation, but also the reality of people's hearts broken. And so the being alongside, I think that one of the key things is about maintaining, I think Monsignor Vitello was referencing that, but maintaining as far as we can the rituals around grieving and guidelines. Really important to have guidelines for safe and dignified burials that allow people to grieve, but also protect all who are concerned in the funerals. But I think on the science piece, I think it's about holding both together. So we also have really valued being part of the WHO conversations, developing the guidelines for faith communities on different aspects of our life as worshippers, but also our lives in communities. And I think the question the person was referencing there was, how do we help people to overcome their hesitations? I think taking questions seriously. People have all sorts of different reasons for questioning, really valid reasons, as well as this barrage of fake news that comes. And so that accompaniment, the being alongside, is also about listening really carefully to what people are saying, and then working both with the ethical issues that we heard about from Monsignor Vitello, but also working with the scientific facts to help people through that, and working with trusted people who are seen as authentic sources of information to those local communities. Thank you.
Thank you. I think this webinar is one way that we try to show and model this cooperation from faith actors, religious leaders, faith communities, and agencies like WHO. But there's also opportunity for faith leaders to share what they feel is needed and want to be addressed. And I'd like to just maybe point this question to Priestess Beatrice, because there was a very interesting question about, there's a lot that has been done, and I know faith community has done it. Some governments are announcing what they will do or what they have done. Of course, agencies, UN agencies have to, but is there anything more that still can be done from your perspective, the indigenous perspective, to expedite the availability of vaccine to the global south? There's one question that came out from that. Maybe this is a very big question, but I think maybe your perspective just to start the ball rolling would be very interesting. And then we could go back to the others.
Yes, what I feel is that voices are expressing concern, are expressing also what should not be done and what should be done. I think Pope Francis speaks very loudly about certain issues, but I still feel that those who do the harm are not listening, They have not listened to some of our leaders in the past. They don't listen to the leaders today. So that's why I really feel that we need to make a big coalition, and we need to come to these people who are not understanding, with lovingly but in force somehow, to make them then change the way they're doing things. In our country, I can say that they do the best they can with what they have and with what they are allowed to do. Because remember, our countries are sometimes under pressure. They're not allowed to do always the way they want. If they want to go and buy a vaccine in certain countries, they're not allowed to. So it is. I think we need to change and try to work more together. That is what I think. So.
Thank you. I know I put you on the spot in a sense. I just wanted you to have a chance to just give your wish list, say what you expect. And anyone else in the panel would like to respond to that, about what more can be done or what you would like more to be done from a faith perspective. Rachel.
I would love to build on what Priestess Beatrice said. I think this idea of the coalition, which is effectively what we're seeing here with faiths and all peoples of goodwill. I love the word you used about lovingly but in force. And I think this is really, it's like the prophetic voice that we talk about in the faith traditions. But I also think that in your earlier inputs, you highlighted very rightly the issue of economic nationalism, and there's a real issue here which we see even is reflected in what came out of the G7, that it talks about some commitments in terms of distribution of excess vaccines, but when it talks about sharing intellectual property, technological transfer and so on, it's still about the power being in the hands of the pharmaceuticals, that it's voluntary and it will require their agreement. And actually I think we need to move beyond that. There is a values proposition here which is about the public goods, and so I just really wanted to echo what you're saying. How do we move beyond a sense of economic nationalism and donations being sort of a charitable piece, to actually saying this is about humanity, us together in our common home.
That's right. This is about humanity and common home. Robert.
Yes, certainly very much in the line of Canon Carnegie and Priestess Beatrice. I think it's also looking beyond the present situation and asking ourselves how we could make the world better, how we could change things, because we certainly, we knew these abuses, and we knew that many injustices and much inequity existed in the world, but the kinds of close down of our supply chains and blockage of what we thought was normal economy, really has shown us that we need to do something different, and we need not only to respect each other in a different way, we also need to respect the nature that God has given us as such a wonderful gift. So I hope it's looking beyond and therefore preparing the future in a different way.
Now, before I pass the time to my colleague Dan Irvine to give us kind of a synthesis I was just interested to hear from the panelists, when you were listening to one another, what was one particular thing that struck you, that when you were hearing from each other, especially coming from different backgrounds and different layers, and of course, you also probably saw some of the comments in the chat as well. What is one particular thing that you are taking back today as we have this conversation together? And just opening up anyone who would like to start first. Maybe I will invite, Mr. Beatrice, go ahead.
I think it's very beautiful when we sit together like that, virtually, but we sit together, and we sort of have the common ideas and common way of thinking. Unfortunately, the history has separated us somehow, and created sort of a segregation between us. And we also need to overcome that. You know, our spiritual ancestral traditions, we have been suppressed for centuries, but we're still alive and we're still struggling and all that. When I joined years ago, Religions for Peace, it was with the idea that we can work together. It is very difficult. We have to overcome these difficulties and really work together.
That's right, working together. Maybe I'll just go with what's on my screen. I'll go with Rachel and then Robert, and then I'll invite the one that is furthest away in the sense of the latest at night, Reverend Wada, to end this part, and then we'll go to everyone. Just maybe one sentence or two things that you take back from today. Rachel.
Thank you so much. I think this has been a kind of a wonderful model of actually what it is all about, which is about the mutual listening, understanding our interdependence. This is not about nation states. This is about humanity. And I think that this gathering here from around the world and around the faiths models that. And that we need to go further. You know, this is a deep challenge for me as well. How do we seek further collaboration? Because together we represent the vast majority of that humanity. And so what is it that we can do more together? And I'm going to take away those words from Priestess Schultes about lovingly but in force. So thank you for that.
Thank you. Monsignor, how about you?
Well, I go back to at least Pope Francis's vision of the boat, and I do think we are in it all together, even though there's a great deal of inequity and sinfulness among us. But I do think we're in the same, and we need to learn how to row together so that we could prepare for the future. And then I think, especially as we look at our world that is so broken politically, economically, socially, that we do have common values, and we need to focus much more on those common values than on the teachings or other practices that may separate us.
Thank you. And Reverend Wada, over to you for some final words.
Thank you very much. I was so impressed to hear each panelist's efforts, and the religious community has made utmost efforts for this pandemic difficult situations. And I found out that more possibility to make more collective efforts or collaboration and cooperation between different religions. And for example, Religions for Peace has established Inter-Religious Humanitarian Fund, and which has implemented 21 projects to address the COVID. So maybe through this interface platform, we can put our efforts and energy together for this difficult situation. Thank you very much.
Thank you. We don't want to drown together, but we're in the boat together, we're rowing together. And I thank my colleague, Dan Irvine. He's going to come and help to bring all of this together. And I know that is a very massive task, but I do not envy you. So I pass the time over to you, Dan. And once again, thank you to all our panelists for sharing not only your thoughts, your work, but more importantly, your heart and what you value. And I think this is important for us. So over to you, Dan, for a summary or synthesis of our time together.
Thank you, Sivan. Thank you so much. And thank you to all of the panelists today. I am just overwhelmed with how wonderful this discussion has been and how important it's been. Just incredible themes emerging today in this continuing series. And I'd like to start by noting that, as had been the focus of previous webinars, this one has also gravitated towards the question of equity, once again, reinforcing its importance. But today, I think we're hearing a much deeper interpretation of faith-based organizations' prioritization of equity as moral actors, and really reinforcing the notion that at the end of the day, equity is a moral question. But perhaps even more importantly, what we've been hearing from all of the speakers is that this pandemic and the disease, while it is a medical question, while it becomes a political question, it is on the ground for all of us a human question. And the challenges we face are challenges of humanity and humanity's solidarity. And I think that theme has really sung today. We've heard about the importance of faith organizations' work in accountability, holding the political actors accountable, and the important role that they play in that work. There was reference to universal access, to the concept of global public goods. And this is a universal destination of goods, and how our faith partners have been evoking those themes in their outreach and in their diplomacy. We've been hearing about how faith organizations have been really working as global diplomats, engaging power brokers and decision makers and influencers at every level from the moral standpoint and the equity standpoint. In terms of the equity, I was very pleased to hear from Monsignor Vitillo the emphasis on not forgetting refugees and internally displaced people, and also the emphasis, the really wonderful emphasis from Priestess Schultes on being concerned with indigenous people's representation also, and the need for there to be not singular faith approaches, but interfaith and collaborative approaches towards helping these populations. On another level, we heard a lot of comments about people's suffering and people seeking solace, and the incredibly fundamental role that faith actors play in cultivating hope and providing that solace to people everywhere. Also in enabling major life events like funerals, like helping people to grieve, maintaining their rituals, continuing liturgy and sacraments in the times when people need them most, because those needs don't go away during the pandemic, they actually become more acute. And Sivan, you mentioned addressing domestic violence at the household level, which is something that we've actually seen escalate during the pandemic and really requires all actors to address. I really appreciated in today's discussion the sense of global faith institutions catalyzing a global level movement, a global level diplomatic movement, if you will, and setting the tone for the global discussions on a moral basis. I think the global engagements that have been represented here today are extremely impressive, and the work that many organizations are doing in terms of creating guidance for their stakeholders down to country, national levels, and community levels is very important in terms of interpreting the nuances and the challenges of the pandemic at a policy level from a faith perspective, and doing that very important interpretation and providing the guidance to folks at all levels. Incredibly important. Monsignor Vitillo mentioned addressing the cell lines issue, for example. but the engagements are broad, working with not only the WHO, of course, but political actors, economic actors like the WTO, and leveraging the global faith organization networks, which are vast. And then perhaps I'll conclude in the area of the commentary about local engagement, the importance of listening to people, respecting people. This comes up in each of our calls, and it's fantastic. Building communication on science and holding, as Reverend Carnegie had just said, holding the science and culture and belief all together, sharing knowledge. And as Priestess Schulthess emphasized today, really working through the traditional cultural means of engaging communities at their level effectively and sincerely. There was, just as the last mention, again, the importance of leveraging faith organizations' infrastructures for service delivery. But there was interesting additions today from Monsignor Vitilio on not only the places of worship, but the outreach programs that faith organizations often sponsor and manage. He mentioned the programs in Pakistan, Afghanistan, Jordan, very important health programs that faith organizations are providing and managing. So really beautiful discussion today, and I'm so thankful to all of the panelists. Thank you, Sivan.
Thank you. Dan Irvine, he's the Senior Director of Health and Nutrition from World Vision International. Thank you so much for doing an amazing job of bringing all of this together. And I was reminded, since we are approaching World Refugee Day, there was a tagline that said, "Together we heal and together we shine." I think that's also a good one for us to end for today. So we suffered together, but we can heal together and shine together, especially so that we can shine out of this dark time. So thank you everyone once again, and I'll pass the time to Sarah to wrap things up for us. Thank you. Over to you, Sarah.
Thank you, Sivan, and I really don't think I can add anything more of much significance to the discussion today. It's really been a pleasure. I just want to acknowledge and express how much I value this time together. As you mentioned, together we heal, and I think all of us here today as individuals, communities, or representatives from institutions are part of that healing process, not only for ourselves but for the world, and it can be exhausting. And so to come together and draw on each other, for strength is important. And so these moments are really, really valuable. And I just want to express my great thanks to everybody for being here today. And to thank you to all the participants as well who provided questions and were active in the chat. As mentioned before, this is part of a series, so please stay in touch, and there will be more. And thank you to my co-host Deepika and B. I wonder if you wanted to make one or two closing remarks, and then we will close this and let everyone get on with their days. B.
Thank you, Sarah. Honestly, nothing much to add. And Dan, thank you so much for capturing all of this so beautifully. I think just to echo what Sarah has already said, this has been really, really inspirational. We really hope that this is not the end of our journey to figure out how we heal together. If anything, I think getting your insights, getting an understanding of what are the hurdles that are going to be coming up next and how we approach them together is so important. And so for me, it's just a huge heartfelt thanks to all of you for your expertise, for your wisdom, for your kindness and your time to give to us as we learn together on how to heal. So just thank you, like a really heartfelt thanks from all of us at UNICEF. Thank you. Deepika, over to you.
Thank you. First of all, a deep and sincere gratitude to all the wonderful panelists, the moderator, and Dan for putting it all together and saying it so succinctly, yet capturing everything. We have heard such inspiring yet practical experiences that are truly making a difference. And as important as it is to know what works, equally critical is to understand what didn't and why, and what needs to be done further. And today, I think we have learned valuable lessons from the speakers in both of these areas, and it's based on their lived experiences, which is so important. And it is clear that in order to overcome the challenges and barriers to vaccination, we need to fully understand the situation and perceptions that prevail and work together to double our efforts. And today, with all of your participation, we're moving towards this bit by bit through these webinar series. We have learned a lot from the experiences and insights that were shared here today, which we hope will be a great inspiration for all of us that will result in helping our efforts in addressing vaccine barriers. So thank you all.
Thanks, Bea and Deepika, and thank you, everybody. I wish you a safe rest of the day. It really has been a pleasure to be with you here.